prevention. Precaution. The aliquots should be used in precaution when the creatine clearance less than 25 or the serum creatinine over 2.5. Typically, we use the aliquots with a low dose when people have this level, creating clearance 5 greater than 2. For Badaxa, we should avoid when creating clearance less than 30. And it's not recommended to start in patient with creating clearance less than 50. So creating clearance at 60 or above is considered a normal renal function. When it's less than 60, it's not normal. And then when it below, when creating clearance below 50, then we should not start Badaxa. And this medication contraindicated with patients who have mechanical valves, liver disease, active hepatitis, cirrhosis, significant LFT elevation. When people have the AST or LFT greater than 2 to 3 of their upper limits, then we should not aliquots over that. Pregnancy, people who are pregnant, they should avoid taking this medication, aliquots, Badaxa. The side effect, aliquots is better in terms of stomach bleed or GI bleed. Badaxa might increase the GI side effects. So people who have stomach problem like peptic ulcer or the colitis or something like that, they should take in Badaxa. Dosing, the aliquot and Badaxa have similar dosing. They take, they should be taken 12 hours or twice a day. For the feeding tube, Badaxa is the Badaxa dosage form available in capsules. So the capsules cannot be crushed or opened. Capsules may be stored. It must be capsules of the be stored in original containers for about when it's open, it's only good for 3 months to maintain their efficacy. When it's open and then it's over 3 months, the medication no longer have the that it should. So if we open the container, then we should not use medication if it's over 3 months. With that issue, we don't recommend people to use the book, for some patients, they used to have the bubble bag for like 90 days set up, and then this medication must store in the original container to and but actually don't have interaction with the VA. It drug interaction. The aliquid or reversal agent called the index alpha. The but that's is either or they have different agents. Generally, but that's common than aliquots, but that's generally used for those people who function and they are young. Otherwise, should be start have the increased risk of bleeding, have stomach like or GI bleeding, and have function problems. And this of the Adaxa of the Adaxa use in the bag or the hospital. Yeah, the patient who on bags for their patient or their question. Why versus Adaxa versus Aliquid? Please let me know in the comment below. Thank you. Today I'm going to talking about the Aliquid or Abiciban versus Diaroto or rivaroxaban. So how do we know which one is better? How do we know how to choose one of these medications for our patients? So first, these medications have similar indications. FDA approved for stroke prevention in non-valvular AFib or atrial fibrillation, and the venous thromboembolism treatment for prevention for different thrombosis or DVT or pulmonary embolism PE. So first we need to look at the renal function to choose this medication. Generally, Aliquid is better for people who have renal impairment or renal dysfunction. Most of the elderly people who over 80 years old do have renal problems, So we should start or initiate Aliquid instead of Diaroto for patients over 80 years old. Aliquid, we need to use precaution when serum creatine clearance less than 25 or serum creatine over 2.5. For these patients with significant renal dysfunction, we need we need to monitor closely, especially we need to test kidney function, the renal function, to make sure patient has no bleeding. For people who have the creatine clearance less than 25 or serum creatinine over 2.5, you might need to reduce the dose to 2.5 milligrams twice a day instead of 5 milligrams twice. For Yeroto, we should avoid patients creatinine clearance less than 30. So I just mentioned should not start Yeroto for patients over 80 years old who have some kidney function problem. This medication generally absolutely contraindicated in patients who have mechanical heart valves, active liver disease like active hepatitis, severe cirrhosis, or significant LFT elevation. If the AST or the the AXT or the ALT over 2 to 3 times their upper limit, then we should not use this medication. People who are pregnant should not use this medication. For the side effect, the most concerned and common side effect is bleeding. So the Eliquis is better than Yeroto for the stomach or GI bleed. So people who have concern about stomach bleeding or they have some kind of stomach problems history, then we should start with the Eliquis versus Yeroto. Dosing, the Yeroto might be advantage compared to Eliquis because Eliquis is taken every 12 hours or twice a day, but Yeroto take once a day or every 24 hours, but full meal, full stomach. So there is one advantage of the Yeroto compared to the Eliquis because it's take once a day instead of twice a day. For people who have problem to remember taking the medication, then they might start with Yeroto if they don't have any other issue like bleeding risk or kidney problems. For some patients, they need to use the feeding tube, and probably the Eliquis is recommended. This medication, they have similar drug interaction. They should avoid the some inhibitors medication, like CYB 384 and GP substrates. So CYB 384 inhibitor and EGB substrate. They have similar antidote or reversal agent. The andexanet alpha or andexa, the brand name. So generally, the Eliquis is recommended more than the Yeroto. Only a few or some patients want one daily dose, then they want to start with the yellow top. You let me know if you have any question on these two medications. Thank you. Talking about the Alaquix versus warfarin. So why you will see some people take Alaquix or Abicibin versus warfarin? When you go to Google and you just search for it, Alaquix versus warfarin, you will have about 600,000 results. Okay, so for the first few one, you can find some quick information why they choose Alaquix versus warfarin or vice versa. So the first one from .net, they say Alaquix is shorter acting than warfarin. Excuse me. So Alaquix is shorter acting than warfarin, and the blood thinner effect is quicker gain and loss after about 24 hours. Alaquix rarely require bridging because it is shorter acting and can be safely stopped a day or two before any medical procedure or surgery. Yeah, so it's Alaquix image and the warfarin image here. It's not always the case. It is just general information. I've been working for the Anticoagulation clinic for many years. So yes, Alaquix, you have to take one twice a day. Whereas the warfarin or Coumadin, you take one tablet one a day. So it's longer half-life and it take a longer time to get to the peak effect and get into stable state. So usually warfarin take 3 to 5 days to start working in your body when you just start warfarin, and then you take 1 to 2 weeks to get to the peak. Like the peak, and then stable state after 2 weeks or so. Alaquix is just similar to the low-enough injection or enoxaparin injection. So Alaquix is the fixed dose medication. Either take 5 milligrams twice a day or 2.5 milligrams twice a day for certain patients. So it works every 12 hours medication. You should take same time every day, every 12 hours, and then the warfarin the same time every 24 hours. Alaquix is very expensive medication compared to warfarin. Alaquix, even though you have a copay, it is very expensive, like $500 per month and about 1,000 or more for 90-day supply. Warfarin is like $10 for 3 months or so it's very cheap. Alaquix is a new medication. I think it's available since 2018 or so. 2017 until now. It's been studied so that the Alaquix is effective, just like warfarin. And for elderly people, it may be convenient. They don't, have to go with the confused dosage with warfarin. Alaquix just take 1 tablet, fixed dose twice a day. so it may be best for a lot of patients, especially elderly people. Warfarin is very complicated in dosing. You know, someday they take one tablet, someday they take half tablet. It's a weekly dose, but you have to take every day. It sounds very complicated. Another advantage of Eliquis is diet. You know, warfarin might be affected by the vitamin K foods like greens, vegetables like kale, cucumbers, spinach, broccoli, things like that might affect warfarin. Some if you eat more vitamin K food, it may make the iron level go down, and if you eat less vegetable, it makes the iron level go up. So you must be stable with vitamin K foods every day. Eliquis is not affected by vitamin K foods, so you know, most of people happy with that. They don't have to watch for their diet. And another advantage of Eliquis compared to warfarin, Eliquis doesn't require close monitoring. Okay, some people, if you are over 75 and you have normal kidney function, normal liver function, you only required to test your blood, you know, every 6 months. And then for warfarin, you know, you had the maximum they can extend the follow-up is 6 weeks. Okay, so 6 weeks you need to come back to get the iron test, your blood test, to make sure your warfarin level is not too high or not too low. When the iron is too low, it means you don't have enough warfarin in your body. When iron is too high, it means you have too much warfarin in your body. It makes heart bleeding. So that's why they have to test your iron level frequently. If you are stable, your iron very stable, then you can come back in 6 weeks. But if your iron level is not stable, you have to come back frequently, like weekly or 2 weeks or 3 weeks, depending on your iron level. If your iron level is critical, it means it's or 6, then you might need to hold warfarin and come back in 3 days or 2 days, things like that. But Eliquis is not frequent follow-up or test. No test required to make sure the Eliquis is enough in the body. No, we don't have that test. That test is very expensive and it's no required. For the side effect, somehow, and then for elderly patients, Eliquis may be better than warfarin because they don't confuse. They are not confused with the dosage. So if they take the Eliquis with the instructed dose, and they have no problem with the bleeding. But for warfarin, sometimes they confuse with the dose, and then they may take a wrong dose, and it will cause bleeding. That's one reason. The second, they understood the Eliquis may be better in terms of solid bleeding to warfarin for the elderly patient. And then the Eliquis is it's just like low enough injection, so you don't have to be breached before the surgery because you may only need to hold for 2 days prior to the major surgery or procedure. But depending on the kidney function, if you have a bad kidney function, then you need to hold more than 2 days, like 3 or 4 days, depending on your kidney function, you know. And the allergists, they only need to monitor the side effect, which is they need to bleeding. So they need to test your complete blood count to make sure the hemoglobin is not too low. If the hemoglobin too low, you might have some kind of internal bleeding. Then you need to pay attention on allergies. You need to go to the stomach doctor to make sure it's not caused by the allergies. And then you need to check your when you're on blood thinner medication. You need to check your stool and your urine frequently to make sure any kind of bleeding. Check your skin to see if any abnormal bruising. Those things that you need to pay attention, and you need to avoid any physical activity that easily cause fall. So those things need to be counseled when you're on any kind of blood thinner medication. So Eliquix generally is maybe better than warfarin in terms of side effect, and then it's more convenient than warfarin because the dose is a fixed dose and they're not required to test frequently, and they're not. And the diet, vegetables, greens, do not affect allergies. So more convenient, and it might be better in terms of side effect for some people. The disadvantage is it's so expensive. Some insurance, some care ensure they don't pay for it. So you need to work out your health insurance to make sure it's covered. And if somebody worry about their therapeutic or their how the allergies work in their body, how do they want to know if enough allergies in the body or not. So if for some people like that, they may stick with warfarin. They don't want to provide the medication. It's not. It does not need the blood test to make sure it's not too low or too high, like warfarin. And some people need to take Eliquix with a lower dose, like 2.5 milligrams twice a day. No people because they over 80 years old and their weight is under 132 pounds, things like that. If they have those two factors, then they require to take a lower dose. If their kidney function, if their creatinine greater than 2.5, then probably they need to take a lower dose. For certain people, like people on dialysis, they may be not the best candidate for the Eliquix. They should stick with warfarin. So, if you have any further question or concern about if you are taking any blood thinner medication, please let me know in the comment below. How to switch from Xarelto to warfarin. You can go to Google again and type in switching from Xarelto to warfarin. You have about 4,500,000 results. So that's a lot, but for the first few
result and learn how to speak to open from the rotor. So they recommend that you need to continue your auto warfarin. You start warfarin and continue the year auto together, overlap for 3 days. So you stop the year auto in 3 days. Switching from year auto to warfarin. Okay. So you start warfarin and then year auto, and then stop the year auto in 3 days. Okay. So hopefully in 3 days, warfarin start working. Okay. But if the in 3 days you detect the I9 level is still too low, like 1.2, 1.3, 1.4, and I would continue year auto for 1 or 2 more days and increase the warfarin a little bit to make sure the patient is safe from blood clot. Make sure that to tell the patient to remember to stop year auto as instructed. Some patients they forgot to stop the year auto. So that's the main thing. The patient, you might call the patient, make sure they stop the year auto as instructed. Otherwise, may cause bleeding. So usually for the new warfarin start, you check the iron level maybe twice a week. Monday and then the next iron first day of Friday. So I would recommend that you should start warfarin and then stop the year auto in 3 days. And then we check the iron. If the iron is still too low, then I would recommend continue for another 1 or 2 days. Then adjust the warfarin dose to make sure it's not too high and not too low. And then recheck in about 3 days to make sure patient is not at risk of blood clot or stroke. And then to make sure the patient is not continue taking both medication, the year auto and warfarin. Okay. So if the iron is still very low and probably need to increase the warfarin, make sure to get to the therapeutic level. And have the patient to report any abnormal bruising or increased bleeding risk. Thank you. How to switch from warfarin to Badaxar. Go to Google and type in switching from warfarin to Badaxar. You have about 340,000 results. The first few top results we may have some comments. Here, PHARMACIST.com give you a very quick information. So you stop warfarin and start Badaxar when iron less than 2. So this is general recommendation that how you apply if you are from the hospital setting. If you work in the hospital, you might check iron daily. So when is iron less than 2, then you start Badaxar on the same schedule. Start the warfarin. And Badaxar is twice a day doses you take one capsule twice a day. How about the outpatient setting? Um, if you check the INR and INR is less than 2, and the patient has the outpatient clinic, and you are able to give the patient the medication, the Badaxa, then the patient can start Badaxa at the schedule of warfarin. Stop warfarin and start Badaxa. But when I'm at the therapeutic level, like between 2 and 3, so you have to wait, like hope for 1 day to make sure I'm less than 1 to 2 days to make sure I'm less than for the patient the Badaxa. But if the patient need to if you need to send the medication to the patient home, if you overnight, it may take one day. And if the INA is at the therapeutic level, then I need to go 1 or 2 days, make sure INA less for the patient. If the INA at the time of visit is like 3 point above the level, 3.1 to 5, then probably the patient needs to go more than 2 days, like maybe 3 days. And how about if the I9, above 3.6 or so, then probably the patient needs to beg to reject I9, just hold a half dose or 1 dose to make sure that I9 back to the normal range, and then recheck it for the notice or further instruction. Depend on the INR level and inpatient or outpatient status to provide best recommendation when doing medicine. How to switch from Badaxa to warfarin, or from a bigger trend to warfarin. So go to Google, and I've been switching from Badaxa to warfarin. You have about 400,000 folks. And when you look at the first few websites right here, start warfarin and start the bigger trend when I'm less than over limit of therapeutic range, less than 2. PharmaCist.com recommend stop warfarin and start the bigger trend when I'm not. So in the hospital setting, you can do daily INR. So you check the INR, it's less than 2, then just stop warfarin and start the bigger trend. But how about the outpatient setting? At the time of business, when INR less than 2, then probably you can hold the bigger trend 1 day and then start the Badaxa. If the patient has the medication on hand, then you may, when INR less than 2, stop warfarin and start the Badaxa. If the patient doesn't have the Badaxa on hand, like you need to overnight the medication, like that, it may take 1 day or so to get to the patient home. So you need to, if the iron at the therapeutic level, then you just hold the bigger pen for 1 day or 2 days prior to the dioxide. If the iron like 3.2, 3.1 to 3.5, then I would hold open for like 3 days or so to make sure that I'm not less than 2, then start the dioxide. But if it's greater than 3.6, I would hold the warfarin for 1 day and have the patient come back in 1 week to recheck the INR for further instruction. So it depends on the INR level in order to recommend how many days you need to hold the warfarin in order to get the INR less than switching that. All right, so how do we switch from warfarin to Xarelto or rivaroxaban? This one is a little bit different. You can go to Google and type switching from warfarin to Xarelto or rivaroxaban. You have about more than 400,000 results. And for the first few ones, there is some information that tell you how to switch to Xarelto from warfarin. So right here they say from warfarin, stop warfarin and start Xarelto when INR less than 3. You know that for the Eliquis or Bedex, when INR less than 2, but for Xarelto it's than 3. Why? Why it's different? Because Xarelto is kind of little bit, it has a little bit longer half-life. So when it has longer half-life, and the medication lasts longer, and then it take longer time to get to the peak effect. So when the INR is less than 3, so you stop the warfarin and start the Xarelto. It takes some time for Xarelto to work in your body. So that's why they want the INR less than 3 instead of less than. So and then similar to Eliquis, if the patient had the life-threatening blood clot or having high risk of stroke, then you may need to consider the anticoagulant injection, luminal injection. So, when you want to switch from Xarelto to warfarin, and then you might need to consider the luminal injection to make sure the patient don't have any stroke risk or any life-threatening blood clot. But when you switch from warfarin to Xarelto, then you only need to know when the INR is less than 3. But it's different from the hospital libation and the outpatient. So in the hospital, you may monitor INR or recheck check INA maybe daily basis to make sure INA less than 3 before you start the Yeroto. But how about the outpatient setting? You don't do the INA daily basis. How do you plan for that? For me, when the INA, for example, at the therapeutic INA, then yeah, I just tell the patient to stop the warfarin, and I overnight the Yeroto, or I send the patient to the pharmacy window so they can pick up the Yeroto and start the Yeroto next day, the same schedule they are taking warfarin. So when I know the INA therapeutic, then it's between 2 and 3, then I'll say go ahead and start the warfarin for tonight and start the Yeroto tomorrow. And I know the patient will receive the medication at window, or you have the patient tomorrow via the overnight service. And how about if the INA too low? If it's too low, then I would just say take half dose of warfarin at their schedule, and then start the Yeroto the next day at the same schedule of warfarin. What happens if the INA too high, like 3.5 or 3.5 or 4, or or about 3. So if it is if the INA about 3.2, then I would just say stop the warfarin for 1 day, and then go ahead and take Yeroto the next day. But if it's 3.5, then I might recommend to stop warfarin for 2 days prior to take Yeroto. If it's 3.6 or above, like 4, stop the Yeroto for 2 to 3 days. But if it's more than 4, then I will have to hold the dose, and I have the patient to come back, in 1 week, and to retest the INA and go from there. But I don't. If it's above 4, and I have to have the patient to reject the INA. That's how I switch from warfarin to Yeroto. So how you switch from Eliquis to warfarin? You can go to Google and type in switching from Eliquis to warfarin. You'll find about more than 300,000 results from this search. But the top few website have some very important information for you. The first one, say converting the Eliquis or Disiband. It recommend start warfarin and stop Disiband 3 days later. So this is correct, but this depends on the warfarin level. For example, the baseline for warfarin, before you start warfarin, you need to get the baseline warfarin. Okay, and the normal warfarin is usually below 0.9 or 0.9. So around that level is no warfarin. The people never are warfarin. But how about if the warfarin level at that time like 0.2, I mean 1.2 or 1.3, like that, and you may need to stop Disiband maybe days or so. And then the second option, they say maybe stop Disiband and then start the Belantrol anticoagulant or the injection anticoagulant. So like Lovenox, and then warfarin at the same time. So for some people, they are very high risk of stroke or high risk of complicated situation. So you need to make sure that the patient not have any kind of life-threatening issue. So at that case, you might, if you want to switch to warfarin, then you probably need to make sure warfarin at a therapeutic level. In order to do that, because it takes about 3 to 5 days in order to make sure that I get to the into the therapeutic level. In order to make sure that you need to have some form of injection, like Lovenox injection, to make sure the patient is not risk of having stroke or dangerous blood clot. So that's about what you need to know when you switching from aliquot to warfarin. But you need to make sure you have the baseline iodine, and then based on the iodine level, you may need to make sure when it's safe to stop the aliquots. Maybe 3 days later, if you have normal baseline iodine. If you have high baseline iodine, then you might need to consider to stop the aliquots a little bit sooner. And then if you think that the patient is very high risk of having stroke or dangerous blood clot, then you need to make sure that you have some form of the injection, like Lovenox injection, make sure therapeutic before you stop the Lovenox injection. Make sure the patient not having stroke or dangerous blood clot, like blood clot in their lungs. Thank you. How to switch from aliquot to warfarin? You can go to Google and type switching from aliquot to warfarin. You can find about 300,000 results for last search. Look at the first few results. The first result is telling you right here, say, converting aliquots or abicipene. So they recommend start warfarin and stop abicipene 3 days later. So basically, it depends on the warfarin level. For example, if I'm at the therapeutic level, yes, then you may stop. I'm sorry. If the iron as the baseline is normal, I mean, usually the normal iron is less than 0.9 or so. Is the people who never take the warfarin before. So you basically just start warfarin and stop abicipene 3 days later. But how about if the iron is higher than the normal level as the baseline? So you need to probably, start the warfarin and stop the abicipene maybe 2 days later to be safe for the bleeding risk. It also say that if you need to make sure, for example, if the patient is very high risk of the blood clot, like acute blood clot, they just have the blood clot in their lung, and the blood clot is very critical, dangerous to the patient. The patient should not be the INR should not be low, or the patient need to have certain anticoagulant in their body. So for that case, then the patient might need to take the warfarin and the injection, like Lovenox injection. So for that case, yeah, you need to stop the Eliquis, and then start the warfarin and the Lovenox together. To start warfarin and Lovenox together from day one for maybe 5 days or more, and then check the INR to make sure the INR levels is at therapeutic, between 2 and 3 or so, and then stop the Lovenox injection and to continue to take a warfarin along. So that's the case that you need to make sure that you how to switch from warfarin to Eliquis. So you can go to Google and type in switching from warfarin to Eliquis or apixaban. You can find about 400,000 results. But the first few websites help you to understanding how to switch from warfarin to Eliquis or other direct acting oral anticoagulations. So for Eliquis, we'll switch to the Eliquis when the INR are less than 2. So, excuse me. So, for example, if the patient INR is therapeutic at the Coumadin clinic visit, I used to have the patient stop taking warfarin about 2 days prior to starting the Eliquis. So, at that time I had time to send out the medication to the patient. For example, if I overnight, then the patient should receive the medication the following day. Or if the patient pick up the medication at the window at the pharmacy, then the patient have the medication ready to switch to the Eliquis from warfarin. So again, it depends on the INR level, so we can have the patient switch from warfarin to Eliquis from the outpatient setting. So if the patient inpatient or hospitalized, then it's easy to stop the warfarin and try to retest the INR to make sure it's less than 2 before start taking the easier for the patient to switch to the Adequate when they're still at the hospital. But if the outpatient management, then you need to like stop the warfarin for 2 days. If the INR at the therapeutic level, and then start the Adequate to make sure the INR less than 2. If the INR a little bit high, like 3.2 or 3.3, then I would recommend to stop the warfarin for 3 days prior to starting Adequate. But what happens if the INR at the really high, like 3.6 or above in the time visit? Then I would recommend I would reduce the dose or take a partial dose and then retest INR in 1 week to make sure INR level therapeutic before switching to the Adequate. And when the INR at the therapeutic level, then just try to hold 1 or 2 days prior to the Adequate, prior to starting the Adequate to make sure the INR is. The COVID-19 caused VTE, the venous thromboembolism, the DVT or PE, deep vein thrombosis or pulmonary embolism. You can go to Google, you can type COVID-19 caused VTE. It will show up, about 840,000 results. So the first few results indicate that the patient with the COVID-19 infection might experience an increased risk of venous thrombosis, the DVT or PE. And then you can see the most popular website in the medical field is uptodate.com. It also shows that the COVID-19 patient might experience decoagulation disorder. And then in the following website, BostonMedicalJournal.com is also show that the patient with COVID-19 are associated with the venous thrombosis. So, yes, the answer is yes, the COVID-19 might cause the venous thrombosis. So, I have experienced some patients who have the COVID-19 vaccine and they are experiencing the increase of the INR. So the COVID-19 vaccines might increase the INR number. It's not much. It's about between 0.5 to 1. For example, people who normally have INR around 2.5, they may the INR to 3.0 to 3.5 after vaccination. So, but it not last long. usually they experience the iron increase in about 3 to 4 weeks. And after that, they back to the normal target, normal range. So in those 3 to 4 weeks, the patient who have increased the iron due to the COVID-19 vaccines are used to decrease the warfarin dose a little bit, like maybe just a half dose per week to make sure that I'm not outrange, not super therapeutic. So, so yes, some people have a concern whether or not the COVID-19 vaccine affect the iron level or not. Yes, they
avoid production or the bigger trend. If you are allergic to Badaxa, you should avoid Badaxa for some indication, such as anti-phospholipid antibody syndrome or mechanical heart valve. You should avoid Badaxa if you are taking rifampin, St. John's wort, because this medication may reduce your Badaxa effect. You should avoid Badaxa if you are taking verapamil, quinidine, azithromycin, clarithromycin, erythromycin, itraconazole, ketoconazole. This medication may increase your Badaxa effect. You should check with your pharmacist or your doctor if you are taking any new medication or over the counter when you taking Badaxa. Some over the counter like Motrin or aspirin might increase risk of bleeding when you take with Badaxa. So make sure you let your doctor or your pharmacist know when you are taking Badaxa. You should avoid Badaxa if you have major and ongoing bleeding with Badaxa. You should not use Badaxa for blood clot. Typically, for people who have related to active cancer, take warfarin or Lovenox instead. You should check with your doctor who manages your blood thinner medication or the anticoagulation clinic for further instruction. Please let me know if you have any questions in the comment box below. Thank you. Avoid Eroto or rivaroxaban if you are allergic to Eroto. You should not use Eroto for some indication such as anti-phospholipid antibody syndrome or mechanical heart valve. You should avoid Eroto if you are taking rifampin, rifadin, carbamazepine, phenytoin, because this medication may reduce your Eroto effect. Avoid Eroto if you are taking itraconazole, ritonavir, it may increase Eroto effect. Your pharmacist, your doctor, or any other medication to make sure there is no drug interactions between Xarelto and prescribed medication or over-the-counter, such as Motrin or aspirin. You should avoid Xarelto if you are having major and ongoing bleeding with Xarelto. You should not use Xarelto if you have blood clots due to active cancer. This is just for your general information. You should check with your doctor or your pharmacist if you have any further questions. Please let me know if you have any question in the comment box below. Thank you. Avoid Eliquis or Abiciban if you are allergic to Eliquis. You should not use Eliquis for indications such as like antiphospholipid antibody syndrome or mechanical heart valve. You should not take Eliquis if you are taking rifampin, carbamazepine, phenytoin, because these medications may reduce the Eliquis effect. You should avoid Eliquis if you are taking ketoconazole, itraconazole, ritonavir, because this medication may increase the Eliquis effect. If you have to take ketoconazole, itraconazole, or ritonavir, you may have to reduce the Eliquis. You should avoid Eliquis if you have major and ongoing bleeding with the Eliquis. You should not take the Eliquis if you for the blood clots due to active cancer. Generally, if you have active cancer, you may try warfarin or diclofenac instead. This is just for your general information. You should check with your doctor who manages your blood thinner medication, your anticoagulant for further instruction. If you have any question, please let me know in the comment box below. Thank you. Heroin addiction. Addiction means you want to have the same feeling the opioid give you. Opioid effect. They give you a good feeling like high, so you continue having that feeling. It means addiction. Heroin is an illegal opioid, such as cocaine. Other non-opioid drugs such as marijuana, methaqualone. Marijuana may be legal in some states for medical treatment. And prescription opioids, including OxyContin or oxycodone, fentanyl. Methamphetamine is non-opioid. It is stimulant. A lot of people start using heroin after they have hard time to get the OxyContin due to the OxyContin issue lawsuits to the manufacturer, Voodoo Pharma. A lot of people will die because of the OxyContin long extended relief effects overdose. The manufacturers had to file a bankruptcy, and now it renamed as Nora Pharma. When the OxyContin supply has problems, the drug cartels take some advantage about that. They start produce the illegal drug, the heroin. The people who have the OxyContin abuse, addiction, dependence, they are looking for a alternate drugs. They are start using heroin. They are start using heroin because this illegal drug is cheaper, but it's equivalent or stronger effects. Heroin dependence or addiction can be physical or psychological. People who have heroin addiction or dependence tend to be overdosed because they want to have the same feeling. In order to get the same feeling, they need to continue to use this drug. When they don't have money to buy the drug, they will commit crimes. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. Fentanyl addiction. Fentanyl is the hot right now because many illegal migrants enter with the fentanyl products. So fentanyl is an opioid drug. We have illegal opioids and prescription opioids. Illegal opioids including heroin or cocaine. Non-opioid legal drugs such as marijuana, methaqualone. Marijuana may be legal in some states, and the prescription opioids including OxyContin or oxycodone. Fentanyl is a synthetic opioid, and non-opioid methamphetamine. Methamphetamine is a stimulant. The prescription opioids including OxyContin, fentanyl, used to treat a severe pain. How it works? Fentanyl might block the pain by binding to the opioid receptors on nerve cells. So what is the pain? The pain is just a symptom. It's not a disease. For example, arthritis is a disease that might cause a pain symptom. You may have a severe pain after a surgery or a major injury. You should use non-opioid medication, Tylenol or Soma, before an opioid or a low-dose opioid as possible to avoid major addiction from a high dose or overdose of the opioid. Fentanyl is being manufactured a lot nowadays from China, and then it gets into the United States via the Mexico border. People who have the heroin or OxyContin addiction or dependence, they start using the fentanyl. Maybe more convenient and it may be cheaper or stronger effects. The OxyContin supply had some issue because there are ongoing lawsuits to its manufacturer, Purdue Pharma. The Purdue Pharma had to file a bankruptcy. Prescription dose for medical treatment, the fentanyl batches from 25 to 100 microgram per hour. Fentanyl 25 to 100 microgram per hour equal to OxyContin 10 milligram every 12 hours. Fentanyl is 50 times more potent than heroin and 100 times more potent than morphine per DEA. So per DEA, the lethal dose is about 2 milligrams or 2,000 micrograms. Many tablets or pills from these illegal migrants found more than 2 milligrams. So one tablet contains more than 2 milligrams. It's enough to kill a person who took that tablet or pill. The fentanyl dependence or addictions can be physical or psychological. Addiction means you want to have the same feeling the opioid give you. Opioid effect, they give you a good feeling like high, so to continue having that feeling. It means addiction. It's easy to get overdosed because you want to feel better and better with that feeling. At least the same or better feeling. So you want to have, so it's easy to get overdosed. When people get overdosed, they can be death, addiction, or dependence may cause crimes due to drug dependence, drug addiction. They may not control themselves because of psychological issues. So people who have addiction or dependence to fentanyl really need medical treatment. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. Fentanyl addiction can be very dangerous. If you have any further questions, please let me know in the comment box below. Oxycontin addiction. Oxycontin is an opioid. Some illegal opioids, including heroin, illegal non-opioid drugs such as marijuana, methadone. Marijuana may be legal for medical treatment in some states. Some prescription opioids, including OxyContin or oxycodone, fentanyl, hydrocodone, codeine, morphine, methadone, and non-opioid methamphetamine stimulant. What is the OxyContin used for? OxyContin is the brand name for the oxycodone. It is extended release, so it can last for 12 hours. It's used to treat a severe pain. How it works? The OxyContin might block the pain by binding to the opioid receptors on nerve cells. So what is the pain? The pain is just a symptom. It's not a disease. A disease is, for example, arthritis is a disease that might cause a pain, such as pain. You may have a severe pain after a surgery or a major injury. You should use non-opioid medication, Tylenol, Motrin, Reset, Soma, before an opioid. Or you should use a low-dose opioid as possible to avoid major addiction from a high dose or overdose of the opioid. Drug abuse, it can be from the doctors who inappropriately prescribe. Manufacturers may be responsible for drug abuse if they fail to manage their distribution appropriately. The opioid abuse may lead to addiction, dependence. It can be physical or psychological. Addiction means you want to have the same feeling the opioid give you. opioid effect or the OxyContin effect, they give you a good feeling, a high, so you continue having that feeling. It means addiction. It's easy to get overdosed because you want to feel better and better with that feeling. At least the same or better feeling. So you want to have, so it's easy to get overdosed. When people get overdosed, they can be death, addiction, or dependence may cause crimes due to drug dependence, drug addiction. They may not control themselves because of psychological issues. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. To monitor and to decrease the drug addiction, some states have prescription drug monitoring programs to monitor the prescribers, the providers or doctors who prescribe opioid medications. So the best thing to avoid OxyContin addiction, you should take OxyContin when it's indicated, such as for severe pain after a surgery or major injury. You should stop the medication as instructed by your doctor. You may check to make sure you don't have this side effect. You may use non-opioid pain relief medication, Tylenol, Motrin, when you have a pain symptom instead of the opioid. If you have any further question, please let me know in the comment box below. Thank you. What is atrial fibrillation or AFib? Atrial fibrillation or AFib treatment duration. What is atrial fibrillation? Atrial fibrillation is when the beat. Sometimes your heart beat too fast, sometimes too slow. That means you may have a blood clot in your heart or in your lung. If you are diagnosed with AFib, then you may be on a platinum medication indefinitely for the rest of your life, unless your cardiologist can convert your heart back to normal. But that's very rare. Sometimes people have AFib, but they don't start the platinum medication yet because they don't have any additional risk factors such as over 75 years old or have high blood pressure, diabetes. Generally, if you have only atrial fibrillation and you do not have any additional risk factors, then you don't have to take the platinum medication yet. They may put you on baby aspirin. So when you have a AFib, your doctor needs to select one of the oral platinum medication. If your AFib is not regular, you may start with the Eliquis, Xarelto, or Badaxa. You don't have to do the frequent monitoring tests like warfarin. If your AFib is regular, then you have to take warfarin. So it is depend on what type of your AFib, and your doctor might put you on the best medication. If you have any further question on this, please give me a comment in the comment box below. Thank you. Protein C or protein S deficiency treatment duration. This medical condition is one of the hypercoagulable states. When you have this medical condition, it may cause a blood clot disorder or blood clot risk. If you know the cause of the protein C or protein S deficiency, then you may need to take a blood thinner medication for 6 to 12 months, especially when you have a blood clot in your leg, like deep vein thrombosis. If you don't know the cause, then you may need to take a blood thinner medication for the rest of your life. The best medication for this indication is warfarin. Other medication like Eliquis or apixaban, Xarelto, rivaroxaban, Adaxa, Dabigatran. Protein C or protein S deficiency treatment duration. If you know the cause of the protein C or protein S deficiency, then you may need to take a blood thinner medication for 6 to 12 months, especially when you have a blood clot in your leg, like deep vein thrombosis. If you don't know the cause of the blood clot, then you may need to take a blood thinner medication for the rest of your life. The best medication for this indication is warfarin. Other medication like Eliquis or apixaban, Xarelto, rivaroxaban, Adaxa, Dabigatran. So for this medication, I think there are ongoing studies. Antithrombin or AT nutrition. This is the blood clot disorder or one of the hypercoagulable states. If you have antithrombin deficiency, but you don't know the cause, you might need to take the blood thinner medication for 6 to 12 months. If you know the cause of the blood clot, and you might need to take a blood thinner medication for 6 to 12 months. If you don't know the cause of the blood clot, then you may need to take a blood thinner medication the rest of your life, especially when you have a blood clot in your leg or your lung. The best medication for this indication is warfarin. If you have any further question, please let me know in the comment box below. Thank you. Factor V latent deficiency treatment duration. What is factor V latent deficiency? This is a blood clot disorder. It is one of hypercoagulable states. There are two types of factor V latent deficiency. First one is homozygous factor V latent deficiency. This is high single risk of having blood clot. So if you don't have any blood clot in your leg, your lung, then you may not need to take the blood thinner medication yet. If you do have a blood clot in your leg or your lung history, you might need to take a blood thinner medication such as warfarin for 6 to 12 months. The second type of factor V latent deficiency is heterozygous. This is the major or multiple risk of having blood clot. If you are diagnosed with this type of factor V latent deficiency, then you may need to take a blood thinner medication indefinitely, regardless of having a blood clot in the past. The best medication for this indication is warfarin. There are ongoing studies for the other medication with Xarelto Adaxa for this indication. If you have any further question, please let me know in the comment box below. Thank you. Antiphospholipid antibody syndrome, AAS, or lupus anticoagulant. Treatment duration. Antiphospholipid syndrome or lupus anticoagulant is one of the hypercoagulable states. People have lupus may have the antiphospholipid antibody syndrome. This is the blood clot disorder. So they may have blood clot in their leg. If you have antiphospholipid antibody syndrome or lupus anticoagulant, you may need to take a blood thinner medication indefinitely or for the rest of your life. The blood thinner medication for this medical condition is warfarin or Coumadin. You should avoid taking Eliquis, Xarelto, Adaxa. If you have any further question, please let me know in the comment box. Thank you. If you have rheumatic mitral disease, you may need to take a blood thinner medication if you have a history of blood clot. And how long you have to be on blood thinner medication for this medical condition. You may need to take a blood thinner medication for the rest of your life or indefinitely. And the best medical this condition is warfarin. If you have a history of rheumatic mitral valve disease and you have acute blood clot, such as pulmonary embolism, blood clot in your lung, then you may need to take a blood thinner medication for the rest of your life or indefinitely. And the best medication for it is warfarin. If you have any further question, please let me know in the comment box below. Thank you. Pulmonary embolism or PE. What is pulmonary embolism? It is a blood clot in your lung. So how long you have to take a blood thinner medication if you have a blood clot in your lung? If you know the cause of a blood clot in your lung or the cause of the blood clot, you may only need to take a blood thinner medication for about 3 to 6 months if that is the first time you have a blood clot in your lung. If you don't know the cause, don't know why you have a blood clot in your lung, and if that is the first time you have a blood clot in your lung, you have to take a blood thinner medication for 6 to 12 months. If you have a second time blood clot in your lung or recurrent blood clot in your lung, then you may need to take a blood thinner medication definitely or for the rest of your life. If you have a blood clot in your leg and blood clot in your lung, so that considered recurrent blood clot, you may need to take a blood thinner medication indefinitely or for the rest of your life as well. If the blood clot is considered at high risk for a recurrence, then you may need to take a blood thinner medication longer, maybe for the rest of your life or definitely. And finally, if you have a blood clot in your lung and it's related to an active cancer, then you may need to take a platinum medication until you no longer have cancer, and at least for 3 to 6 months. So you have to take a platinum medication at least for 3 to 6 months and until you no longer have active cancer. If you have any further question about this, please let me know in the comment box below. Thank you. Deep vein thrombosis or DVT. What is deep vein thrombosis? Deep vein thrombosis is a blood clot in your leg. So, how long you have to be on a blood thinner medication if you have a deep vein thrombosis or blood clot in your leg? You have to take a blood thinner medication in about 3 to 6 months if you know the cause of the blood clot. And if that blood clot is the first time in your life. If you don't know what is the cause of the blood clot in your leg, then you might need to take 12 months if that is the first time you have a blood clot in your leg. If you have a second time of blood clot or recurrent blood clot in your leg, then you may need to take a blood thinner medication indefinitely or for the rest of your life. If the cause of blood clot in your leg because of an active cancer, then you need to take a blood thinner medication until you no longer have a cancer. This is the general information for how long you need to take a blood thinner medication if you have a blood clot in your leg or a deep vein thrombosis. If you have any further question, please let me know in the comment box below. Thank you. Mitral heart valve treatment duration. If you have mechanical mitral heart valve, you may need to take a blood thinner medication for the rest of your life or indefinitely. The best medication for your mechanical mitral heart valve is warfarin. If you have a bioprosthetic or tissue mitral heart valve, you may only take blood thinner medication for about 3 months. Then you will be put on aspirin for the rest of your life. This is the general information for how long you have to be on blood thinner medication if you have mitral heart valve. You should follow your cardiologist's instructions, including treatment period and duration. If you have any further question, please let me know in the comment box below. Thank you. Transient ischemic attack, TIA, or mini stroke treatment duration. So the duration, it could be clinical adjustment. So it depends. After the TIA, you might need to take the aspirin or warfarin if anticoagulant is indicated. So your doctor will determine how long you have to be either on aspirin. Generally, people take aspirin to prevent another TIA. For some people, they would have to take an anticoagulant, such as warfarin, to make sure they are safe from the transient ischemic attack, TIA, or mini stroke. If you have any further question, please let me know in the comment box below. Thank you. Aortic heart valve treatment duration. If you have mechanical aortic heart valve, you may have to take a blood thinner medication indefinitely for the rest of your life. The best medication is warfarin. If you have bioprosthetic aortic heart valve or tissue aortic heart valve, then you might need to take a blood thinner medication for about 3 months, and then you take aspirin for the rest of your life. This is general information for how long you have to take a blood thinner medication. You have aortic heart valve, your cardiologist will tell you exactly how long you have to be on a blood thinner medication or an aspirin. If you have any further question, please let me know in the comment box below. Thank you. Stroke and blood thinner medication treatment duration. So if you have a stroke, blood thinner medication, you know how long you have to be on a blood thinner medication. If you know your stroke because of embolic causes such as atrial fibrillation or heart valve, then you have to take a blood thinner medication indefinitely or for the rest of your life. The best medication for it is warfarin. If it's not because of embolic causes, then you don't have to take a blood thinner medication, but you may need to take either aspirin or clopidogrel or Plavix indefinitely or for the rest of your life. Your cardiologist will decide what is the best treatment therapy and duration. So you should follow their instruction. If you have any further question, please let me know in the comment box below. Thank you. Dilated cardiomyopathy treatment duration. If you have dilated cardiomyopathy and you have a history of blood clot or a history of atrial fibrillation, then you may need to take a blood thinner medication for the rest of your life or indefinitely. If you have dilated cardiomyopathy and ventricular thrombus, may need to take a blood thinner medication for at least 3 months. The best medication, the best blood thinner medication is warfarin. So if you have a history of dilated cardiomyopathy and now you have a blood clot, such as blood clot in your leg or blood clot in your lung, or you have an atrial fibrillation, then you may need a blood thinner medication indefinitely or for the rest of your life. If you have a history of dilated cardiomyopathy and now you have a left ventricular thrombus, then you may need to take a blood thinner medication for at least 3 months. The best blood thinner medication is warfarin. You should follow your cardiologist's instructions for treatment, therapy, and duration. If you have any further question, please let me know in the comment box below. Thank you. Bye. Prior to pacemaker or defibrillator placement, what should you do if you are taking warfarin, Eliquis, Xarelto, or Badaxa? If you are taking warfarin, you should not hold your warfarin. However, you should recheck your INR prior to the procedure. Make sure your INR is therapeutic. If your INR is elevated or critical, and make sure you follow your doctor who manage your warfarin or the anticoagulant to hold your warfarin or adjust your warfarin dose is therapeutic or at the goal level before the procedure. If you are taking Eliquis, Xarelto, or Badaxa, you should check your kidney function to make sure you don't have any bleeding complication from the procedure. You should continue to take the Eliquis, Xarelto, or Badaxa, otherwise as indicated, instructed by your surgeon or proceduralist. If you have any question or concern for me, please let me know in the comment box below. Thank you. Prior to pacemaker or defibrillator battery change, what should you do if you are taking platinum medication such as warfarin, Eliquis, Xarelto, or Badaxa? If you are taking warfarin, you should not hold your warfarin. If your warfarin is therapeutic, if your INR is elevated or critical, then you should recheck your INR prior to the procedure. It's best if your INR is therapeutic before the procedure. If you are taking Eliquis, Xarelto, or Badaxa, you should check your kidney function. Do not hold unless otherwise as indicated. You should follow proceduralist instruction. If you have any further question or concern before this procedure, please let me know in the comment box below. Thank you. What should you do prior to lung biopsy procedure if you are taking a platinum medication such as warfarin, Eliquis, Xarelto, or Badaxa? If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If your INR is therapeutic and you are stable with your warfarin, like you have a stable INR history, then you should hold your warfarin for 4 to 5 days prior to the procedure. If you have a critical INR like over 5, then you may need to hold your warfarin and then reduce your warfarin dose and recheck your INR in about 1 week prior to. If you have to hold your warfarin for more than 3 days, you should switch with a luminal injection to prevent from recurrent blood clot or stroke. You should follow your doctor or the anticoagulant for breaching instruction. If you have to take the Eliquis, Xarelto, or Badaxa, you may need to check your kidney function. If your kidney function is normal or creatinine clearance greater than 50, then you may only need to hold your Eliquis, Xarelto, or Badaxa for 2 days. If your kidney function is not normal when your creatinine clearance less than 50, then you may need to hold your Eliquis, Xarelto, or Badaxa for more than 2 days. When you hold for more than 2 days, then you may need to delay to resume your Eliquis, Geroto, or Adaxa. You should follow your surgeon or procedure list to resume your blood thinner medication. Any question, you should check with your doctor who managed your blood thinner medication or your anticoag clinic. If you have any question for me, please let me know in the comment box below. Thank you. Prior to lung removal procedure, what should you do if you are taking blood thinner medication such as warfarin, Eliquis, Geroto, or Adaxa? If you are taking warfarin, you should recheck your INR in about 2 weeks prior to the procedure. If your INR is therapeutic and your INR history is stable, then you may need to hold your warfarin for 4 to 5 days prior to the procedure. If your INR is critical or elevated, your doctor who manages for your anticoag clinic may need to hold your warfarin or reduce your warfarin dose and recheck your INR in about 1 week to make sure your INR is good before they can plan for your procedure. If you have to hold your warfarin for more than 3 days, then you may need to bridge with your low injections to prevent from having recurrent blood clot or stroke. If you are taking Eliquis, Geroto, or Adaxa, you may need to check your kidney function. If the creatinine clearance less than 50, then you may need to hold your Eliquis, Geroto, or Adaxa for more than 2 days prior to the procedure. If creatinine clearance greater than 50, then you only need to hold your Eliquis, Geroto, or Adaxa for 2 days prior to the procedure. You may need to delay to resume if you hold for more than 3 days. You need to follow your doctor or the anticoag clinic instruction. You should resume your blood thinner medication as instructed by your surgeon or procedure list. If you have any further question, please let me know in the comment box below. Thank you. Spleen surgery or the vascular surgery related to spleen. Prior to spleen surgery, what to do prior to spleen surgery if you are taking warfarin or Eliquis or Geroto or Adaxa. If you are taking warfarin, you should recheck your INR in about 2 weeks prior to the procedure. If your INR is at therapeutic, you should go ahead and hold your warfarin for 4 to 5 days prior to the procedure. If your INR is a little bit elevated, you should adjust the dose a little bit and hold your warfarin for 4 to 5 days prior to the procedure. If your INR is very elevated or critical, then you need to hold your warfarin and reduce the dose and come back in about 1 week to make sure your INR improve, get back to the therapeutic level. Then before you can plan for the procedure. Anytime you need to hold your warfarin for more than 3 days, then you need to reach with the Lovenox injection. If you have a history of recurrent blood clot or stroke and strong risk factor of having blood clot or stroke, such as factor V deficiency. If you are taking the Lovenox injection to bridge when you off warfarin, you need to follow your doctor who manages your warfarin or the anticoagulating instruction closely. Make sure you understand when you need to start the Lovenox injection, when you need to stop the Lovenox injection before the surgery, when you need to resume after the surgery, and when you need to completely stop the Lovenox injection therapy. If you are taking Eliquis, Xarelto, or Badaxa, you should check your kidney labs, make sure they are up to date. If they are more than 3 months old, then you need to update the labs. For those people who have kidney problems, such as kidney failures or chronic kidney disease, they should get the update lab. They should get the update lab sooner than 3 months. If they have a normal kidney function, if your kidney function is normal, you should hold for 2 days and resume the day after the procedure. If your kidney function is not normal, your creatinine clearance less than 50, you might need to hold more than 2 days, and you might need to delay resuming your Eliquis, Xarelto, or Badaxa. You also need to check with the surgeon or proceduralist to make sure if you are safe to resume your platinum medication. When is safe? When you are safe to resume your platinum medication. If any different, you should update to your doctor who manages your warfarin, your anticoagulant. If you have any further question, please let me know in the comment box below. Thank you. Liver surgery or vascular surgery related to liver. What to do prior to liver surgery if you are taking a such as warfarin, Eliquis, Xarelto, or Badaxa. If you are taking warfarin, I will recommend that you should recheck your INR about 2 weeks prior to the procedure. If the INR result is therapeutic, then you should hold your warfarin 4 to 5 days prior to the procedure. If the INR result is slightly elevated, then you should adjust your warfarin dose a little bit and hold 4 to 5 days prior to the procedure. If you have very elevated INR or critical INR, then you may need to hold your warfarin and reduce the dose and come back in 1 week to recheck your INR to make sure your INR improve, return to therapeutic range before you can plan procedure. So you should follow your doctor who manages your warfarin or anticoagulant closely to you have a appropriate plan for surgery. Anytime you have to hold your warfarin more than 3 days, I would recommend that you should consider reaching with the Lovenox injection if you have a history of recurrent blood clot or stroke and strong risk factors of having blood clot or stroke, such as factor 5 deficiency or some kind of genetic. If you have to reach with the Lovenox injection, you need to follow for the anticoagulation closely to make sure you understand when you need to start Lovenox injection, when to stop Lovenox injection for the surgery, and when to resume your Lovenox injection after the procedure, when completely stop the Lovenox injection therapy. If you are taking the Eliquis, Xarelto, or Badaxa, you should check your kidney labs, make sure they are up to date within 3 months. If you have kidney problems such as kidney failures or kidney disease, then you need more than the normal people. If your kidney labs within normal limits, then you should hold for 2 days. If the creatinine clearance not within normal limit, for example, if less than 50, then you may need to hold more than 2 days. You should resume your Eliquis, Xarelto, or Badaxa the procedure if kidney function is normal. You should delay resuming your Eliquis, Xarelto, Badaxa if your kidney function is not normal. You may resume 2 to 3 days after the procedure. You should also check with your surgeon or proceduralist. Make sure you are safe to resume your blood thinner medication. If any difference, you need to talk to your doctor who manages your blood thinner medication or your anticoagulation. If you have any question, concern, please let me know. Box below. Liver biopsy. What to do prior to liver biopsy procedure if you are taking a blood thinner medication such as warfarin, Eliquis, Xarelto, or Badaxa. If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If your INR is therapeutic, then you may need to hold your warfarin for 4 to 5 days prior to the procedure. If your INR is elevated, then you may need to adjust your dose to make sure your INR improve, even your INR history is stable. And then you need to hold your warfarin for 4 to 5 days prior to the procedure. If your INR is very elevated or critical, then you need to fix your INR and reduce. You need to hold your warfarin and reduce the dose and come back in 1 week to recheck your INR to make sure your INR improve or therapeutic before you can plan for the procedure. You should follow your doctor who manage your warfarin or the anticoagulation closely. You have a good plan for your procedure. Anytime warfarin more than 3 days, may need to consider bridging with the lobenor injection. If you have a history current blood clot or strong risk factor of having blood clot or stroke, if you have to take the lobenor injection, you need to follow your doctor who manage your warfarin or the anticoag instructions. Make sure you understand you need to start the lobenor injection. When you need to injection right before, when you need to resume your lobenor injection, the procedure, when you need to completely stop the lobenor injection therapy. If you are taking Eliquis or Xarelto or Badaxa, you should check your kidney labs to make sure your kidney function is normal. If your kidney labs are more than 3 months old, then you should need update labs. If you have kidney problems such as kidney failure or chronic kidney disease, you might need kidney labs sooner than 3 months. If your kidney function, excuse me, if your kidney function is normal, then you only need to hold for 2 days prior to the procedure. If creatinine clearance less than 50, then you may need to hold your Eliquis, Xarelto, or Badaxa more than 3 days, and you may need to resume the procedure. If your kidney function is normal, you can resume your Eliquis, Xarelto, Badaxa in 1 day after procedure, the day after the procedure. If your kidney function is not normal, your creatinine clearance less than 50, then you may need to delay resuming your Eliquis, Xarelto, or Badaxa. You should also check with the surgeon or proceduralist when it's safe to resume your blood thinner medication. If any different, you should let your doctor who manages your warfarin or blood thinner medication or the anticoagulation so they can update the recommendation. If you have any question for the liver biopsy procedure, if you are taking warfarin or other blood thinner medication, please let me know in the comment box below. Thank you. Transurethral resection of the prostate, TURP procedure. What should you do prior to transurethral resection of the prostate procedure if you are taking a blood thinner medication, such as warfarin, Eliquis, Xarelto, or Badaxa? If you are taking warfarin, I will recommend you should recheck your iron about 2 weeks prior to the procedure. If you have a therapeutic INR, then you should hold for 4 to 5 days prior to the procedure. If your INR is elevated, you need to fix your INR, come back in 1 week to see if it improved, and plan for the procedure. If your INR critical, you need to hold warfarin, reduce the dose, and come back in 1 week, check your INR, plan for the procedure. Anytime you hold your warfarin more than 3 days, you consider reaching with the lobe injection if you have a history of recurrent blood clot or stroke and strong risk factors of having blood clot or stroke. If you have to reach with the lobe injection, you should follow your doctor who manages your warfarin or the anticoagulation instruction closely to understand when you need to start the lobe injection, when you need to stop before the procedure, when you need to resume it at the procedure, when you stop the lobe injection quickly. If you are taking the Eliquis, Xarelto, or Badaxa, you should check your kidney function, your labs. Make sure you are up to date. If your labs were done more than 3 months ago, then you might need to repeat. If you have kidney disease, kidney failure, you may need to repeat the lab sooner. If your kidney function is normal, you need to hold for 2 days. If your creatinine clearance less than 50, to hold more than 3 days, and you delay resuming. You should check with the surgeon or proceduralist to see if you are safe from resuming the platinum patient. If any different, you should check with a doctor who manage your platinum patient for the anticoagulation. Make sure they have the updates. If you have any question or concern about this procedure, what to do prior to this procedure, and or if you are taking platinum patient, please let me know in the comment box below. Thank you. Bladder tumor procedure. What should do prior to bladder tumor procedure? If you are taking warfarin, Eliquis, Xarelto, or Badaxa, I would recommend you should recheck your INR about 2 weeks prior to the procedure if you are taking warfarin. If you have a therapeutic INR result, then you may need to hold the warfarin 4 to 5 days prior to the procedure. If your INR result is elevated, just slightly high, then and you have a stable INR history, then I need to adjust your INR a little bit to make sure it get back to the therapeutic range. Then you hold for 4 to 5 days prior to the. If your INR result is critical, probably you need to fix that INR by holding your warfarin and reduce the dose to make sure the INR back to the therapeutic range, or plan for the procedure. Anytime hold your warfarin more than 3 days, you need to consider reaching the lobe injection if you have a recurrent blood clot or stroke history and you have strong risk factor of having blood clot or stroke, then you need to treat with low injection or warfarin for more than 3 days. Your doctor who manages your warfarin or the anticoagulant will give you a separate instruction for the low treatment. You should follow the instruction closely to understand when you need to stop low injections, when you need to stop them before the procedure, when you need to resume them, when you need to stop the low injection quickly. If you are taking the Eliquis, Xarelto, or Badaxa, you should check your kidney labs. Make sure it's up to date. If they are more than 3 months old, then you may need the labs. If you have kidney failures or kidney disease, then you may need to consider updating your lab sooner than 3 months. If your kidney function is within normal limit, then you may need to hold for only 2 days prior to the procedure. If your kidney functions is not normal, as your creatinine clearance less than 50, you might need to hold more than 2 days, and you might need to delay resuming your Eliquis, Xarelto, or Badaxa. You should check with the surgeon or proceduralist. Make sure if you are safe to resume your platinum patient after the procedure. If anything different, I need to discuss with your doctor who manages for platinum medication or anticoagulant. If you have any question, concern, please let me know in the comment box below. Prostate biopsy procedure. What to do prior to prostate biopsy procedure if you are taking a blood thinner medication like warfarin, Eliquis, Xarelto, Badaxa. If you are taking warfarin, I would recommend that you should recheck your INR about 2 weeks prior to the procedure. If your INR history is stable and your INR result is therapeutic, then you will need to hold for 4 to 5 days prior to the procedure. If your INR history is not stable, your INR result is elevated, then you may need to adjust the dose and come back 1 week if needed to make sure your INR improve before and plan for the procedure. If your INR is critical, then probably you need to hold your warfarin and adjust the dose, reduce the dose, then come back in 1 week. Make sure your INR is improved so you can plan for the procedure. If you have to hold your warfarin for more than 3 days, then you should plan reach with a low injection. If you have history of recurrent blood clot or stroke, and strong risk factor for having blood clot or stroke. If you have to push with the lower injection, you should follow the instruction from your doctor who manage your warfarin or the anticoagulant to make sure you understand when to start the lower injection, when you need to stop for the procedure, when you should resume your lower injection. If you are taking the Eliquis, Xarelto, or Badaxa, you might need to check your kidney function. Make sure you have up-to-date labs. If your labs more than 3 months old, then you need to repeat your labs. If your kidney labs are normal, then you may need to hold for 2 days prior to the procedure. If your kidney function is not normal, you have kidney disease, and your creatinine clearance less than 50, then you may need to hold your Eliquis, Xarelto, or Badaxa more than 2 days. If you have normal kidney function, then you may need to resume 1 day after the procedure. If your kidney function is not normal, then you may delay to resume your Eliquis 2 to 3 days after the procedure. Your doctor who manages your platinum medication or your anticoagulant should give you a complete instruction when to start, when to hold your Eliquis, Xarelto, Badaxa, when to resume. You also need to check with the surgeon or the proceduralist, make sure when it's safe to resume your platinum medication. If they give you a different instruction than your doctor who manages your platinum medication or your anticoagulant, should discuss with the doctor or the anticoagulant. Make sure you are on the same page. If you have any further question, concern about the prostate biopsy procedure, please let me know in the comment box below. Thank you. Kidney surgery or vascular surgery related to kidney. What should you do prior to this surgery? If you are taking warfarin, Eliquis, Xarelto, or Badaxa. If you are taking warfarin, you should recheck your INR about 2 weeks prior to the procedure. If you have stable INR history and your INR result is at therapeutic range, then you will need to hold for 4 to 5 days prior to the procedure. If your INR history is not stable and you have elevated INR result, then probably you need to fix your INR. Come back in 1 week to see if your INR improve, or you can plan for the surgery. If you have a critical INR result, then probably you need to hold your INR and reduce the dose. Come back in 1 week, make sure your INR improve, so you can plan for it. You have a history of recurrent blood clot or stroke, and strong risk factors of having blood clot or stroke, then you need a bridge with a low enough injection. Your doctor who manage your platinum medication, warfarin, the anticoagulation, will give you a separate instruction. Make sure you understand when you should start the low enough injection, when you need to stop right before procedure, when you need to resume after the you should follow the instruction closely. If you are taking Eliquis, Yeroto, or Badaxa, then you need to check your kidney function to make sure you have the up-to-date labs that require. If your lab more than 3 months old, then you need to repeat them. If your kidney function is normal, then you may need to hold for 2 days prior to the procedure. If you have kidney disease or kidney failures, and your creatinine clearance less than 50, then you may need to hold for more than 3 days. When you are required to hold for more than 2 days, then probably you need to delay to resume. So if your kidney function is normal, you may resume the day after procedure. If it's not normal, you may resume 1 day, 2 or 3 days, depend on your kidney. You must also check with your surgeon or proceduralist to see it's okay for you to resume your platinum medication as instructed by the doctor who managed your platinum medication or the anticoagulation. If it is different recommendation, then you need to discuss with your doctor who managed your platinum medication. If you have any further questions, please let me know in the comment box below. Thank you. Kidney removal procedure. What should you do prior to kidney removal procedure? If you are taking the platinum, such as warfarin, Eliquis, Yeroto, or Badaxa. If you are taking warfarin, you should recheck your iron about 2 weeks prior to the procedure. If you are stable with warfarin for a few months, then and you have a therapeutic result, you might need to hold 4 to 5 days prior to the procedure. If your iron result a little bit high, then a little bit elevated, you may need to adjust your warfarin dose a little bit, then hold 4 to 5 days. If you have really high or very elevated INR or critical INR, then probably you need to fix your INR to make it therapeutic before you can plan for the procedure. You may need to come back in 1 week to see if your INR improved, so you can plan for the procedure. And if your INR improved, then you might need to hold 4 to 5 days prior to the procedure. When you hold your warfarin more than 3 days, you should plan for reaching with a low enough injection If you have a history of recurrent blood clot, recurrent stroke, and strong risk factors of having blood clot or stroke, when you have to prescribe the Lovenox injection, it should give you a separate instruction when you need to start your Lovenox, when you stop before the procedure, when you should resume your Lovenox after the procedure. If you are taking Eliquis, Xarelto, or Pradaxa, you may need to check your kidney function. Make sure you have up-to-date labs. If you have your current labs more than 3 months old, in the labs within normal limit, then you may need to hold for 2 days prior to the procedure. If your kidney labs not within normal limit, if you have kidney disease and your creatinine clearance less than 50, then you may need to hold more than 2 days. When you need to hold more than 2 days, then you may need to delay to resume your Eliquis, Xarelto, or Pradaxa. So, your doctors who manage you, Eliquis, Xarelto, or Pradaxa, or the anticoagulation, will give you the complete instruction when you need to hold Eliquis, Xarelto, or Pradaxa and to resume after the procedure. However, you should check with your surgeon or proceduralist to make sure you are safe to resume your platinum medication. If you need to delay to resume your platinum medication, then you need to discuss that with your doctor who manages your platinum medication. If you have any further questions, please let me know in the comment box below. Thank you. Kidney biopsy procedure. What should you do prior to kidney biopsy procedure if you're taking platinum medication such as warfarin, Eliquis, Xarelto, Pradaxa? If you're taking warfarin, you should recheck your INR about 2 weeks prior procedure. If your INR history is not stable and your current INR is critical, then you need to make sure your INR back to normal at therapeutic level. So they might need to hold your warfarin and reduce the dose and have you come back in 1 week to make sure that your INR return to the normal range, to the therapeutic range, before they can plan for the procedure. When your INR has the therapeutic range, they will have you to hold for 4 to 5 days prior to the procedure. If you have medical condition indicated you must be breached with the Lovenox injection, then your doctor who manages your warfarin or anticoagulation, they will instruct you how to start your luminal injection, when to stop, when to start your Lovenox, when to stop Lovenox before the procedure, and when to resume. That's very important. You need to follow your doctor who manage your warfarin for the anticoagulant. If you are taking the Eliquis, Xarelto, or Badaxa, you may need to check your kidney function. Make sure you have up-to-date labs that require. If your lab more than 3 months old, then you may need to eat the labs. It depends on your kidney function. You may need to hold more than 2 days. If you have normal kidney function, you only need over 2 days prior to the procedure. If you have kidney disease or kidney failures, and your creatinine clearance less than 50, then you may need to hold Eliquis, Xarelto, or Badaxa more than 2 days. When you have bad kidney function, then you may need to delay to resume your Eliquis, Xarelto, or Badaxa. Your doctor who manages your blood thinner medication or your anticoagulant will give you complete instruction when to stop and to resume Eliquis, Xarelto, or Badaxa based on your kidney labs. But you may need to ask or check with your surgeon or proceduralist when is the best time to resume. If they delay to resume your blood thinner medication, you need to discuss that with your doctor, manage your blood thinner medication or your anticoagulant. If you have any further question regarding your kidney biopsy procedure, let me know. Prior to ablation procedure, what should you do prior to ablation procedure if you are taking blood thinner medication or when you're taking blood thinner medication? Do not hold your blood thinner medication unless otherwise as instructed. For warfarin, you should test for INR weekly, 3 to 4 weeks prior to the procedure. Test INR weekly, 3 to 4 weeks post-procedure. Your INR must be therapeutic every week before the procedure. If for some reason your INR is not therapeutic, then you may need to restart the cycle. If you take Eliquis, Xarelto, Badaxa, you should continue taking this medication unless otherwise as instructed. If you miss any dose, report to proceduralist or the anticoagulant. Cardioversion. What to do prior to cardioversion procedure if you are taking blood thinner medication such as warfarin, Eliquis, Xarelto, or Badaxa. Typically, you must be on blood thinner medication before they can do the cardioversion procedure. And do not hold your blood thinner medication prior and after cardioversion. You must test your, if you take in warfarin, you must test your INR weekly. You must test your INR weekly for 3 to 4 weeks prior to the procedure. And then test your INR weekly for 3 to 4 weeks post-procedure. Your INR weekly must be therapeutic or in range before they can perform the procedure. If you are not therapeutic, not in range, they need to restart the cycle 3 to 4 weeks prior to the procedure. And then after the procedure, you are not supposed to be therapeutic. If not, if you are not too low, they may need to reach you with a lobanol injection. For the Eliquis, Xarelto, or Badaxa, you have to continue taking this medication. If you miss any dose, you need to report to the proceduralist or your anticoagulation or the doctor who managed the warfarin or medication. So generally, you should not hold your platinum medication before and after the cardioversion, or with after. If you miss any dose, you should let your doctor know. The surgeon or proceduralist or the anticoagulation, so they have to adjust your cycle. Most of the hospital, they prefer you to take warfarin before after the cardioversion instead of other platinum medication, Eliquis, Xarelto, or Badaxa. If you have any further question, please let me know in the comment box below. Thank you. What should you do prior to cardiac catheterization or heart cath when you or if you taken platinum medication such as warfarin, Eliquis, Xarelto, or Badaxa? Cardiac cath is the serious surgery, so if you take warfarin and you are stable with your INR history, or if your INR history is stable for a long time, then you should recheck your INR about 2 weeks prior to the procedure. You might need to hold your warfarin 4 to 5 days prior to the procedure. You need to be bridged with a lobanol injection if you have a history of recurrent blood clot or stroke, or you have strong risk factors for increased risk of stroke or blood clot when you're off warfarin more than 3 days. If you have to bridge with lobanol injection, then you need to follow your doctor who managed your warfarin or the anticoagulation. Make sure you understand when to start the lobanol injection and when to stop right before the procedure, and when you can resume the lobanol injection. If your INR result slightly high, you might require to reduce in 1 week or reduce in for 4 to 5 days prior to the procedure. For the Eliquis Xarelto Adaxa patient, they might need to check the kidney lab, make sure their kidney is normal. They probably need to update the labs if their previous labs were done more than 3 months. If their kidney function is normal, they may need to hold for 2 days prior to the cardiac surgery. If they have unstable kidney function or chronic kidney disease and their creatinine clearance less than 50, then they may need to hold more than 2 days. If they have to hold for more than 2 days, then they might need to delay resuming the Eliquis Xarelto Adaxa. So the doctor who managed your Eliquis Xarelto Adaxa or the anticoagulation will give you specific direction or instruction when to hold your Eliquis Xarelto Adaxa and when to resume. But you should check with your surgeon or procedure list to make sure when to resume, because sometimes I have bleeding after the procedure or surgery. So your surgeon or procedure list may delay to resume the platinum medication. Please let me know if you have any question in the comment box below. Thank you. Hello. What should you do prior to colonoscopy procedure if you are taking platinum medication, such as warfarin, Eliquis, Xarelto, or Adaxa? For warfarin, you should recheck your INR about 2 weeks prior to the procedure. If the INR is therapeutic, then you should hold your warfarin for 4 to 5 days prior to the procedure. You may need to be bridged with the Lovenox injection if needed. If you have recurrent blood clot history or recurrent stroke history or any strong risk factor indicating you have high risk of blood clot or stroke when you off warfarin more than 3 days, then need to be bridged with the Lovenox injection of warfarin for more than 3 days. If you have a very elevated INR, like critical INR, then you need to hold your warfarin and reduce the dose of warfarin to get to the therapeutic before you can plan for the procedure. If your INR slightly high, then need to adjust the dose and recheck in 1 week if needed, or adjust the dose and plan to hold for 5 days or so for the. If you have to use the local injection for breaching, then you should follow your doctor your doctor who manage your warfarin for the anticoagulation. Make sure you understand when to start the local injection and when to stop before the procedure, when to resume the Lovenox after the procedure. If you are taking Alaquix, Geroto, or Badaxa, you probably need to check your if not within 3 months. Your Alaquix, Geroto, Badaxa may need to be held for 2 days prior to colonoscopy procedure. If you have a normal kidney function, if you have a kidney disease or your kidney function is not normal, like your serum creatinine not within normal limit, then you might need to hold your warfarin. Excuse me. Then you need to hold your Alaquix, Geroto, or Badaxa more than 2 days. When you need to hold your Alaquix, Geroto, or Badaxa more than 2 days because of your kidney function issues, then you may need to delay to resume this medication. So typically you resume Alaquix, Geroto, or Badaxa 1 day after the procedure. But if you have kidney problems, then you may need to resume your Alaquix, Geroto, or Badaxa 2 days or more. So you need to follow your doctor who manage your warfarin or your anticoagulant and your surgeon or proceduralist. You don't have to reach when Alaquix, Geroto, or Badaxa. You should check with the surgeon or proceduralist to make sure when it's safe to resume your blood thinner medication. If your surgeon or proceduralist recommend to delay to resume your blood thinner medication, you should report that to your doctor who managed your blood thinner medication or your anticoagulant so they can update the recommendation in the systems. If you have any question, concern, please let me know in the comment below. What should you do prior to a dental caps procedure? You don't have to hold your blood thinner medication prior to the dental cap procedure. That's by your doctor who managed your blood thinner patient or hypertension. If you are taking warfarin and you don't have a stable history and you have a critical INR recently, and you might need to check your INR prior to and unless your dental oral surgeon know that you have critical INR recently. If you have any active bleeding, you know to make sure everything's safe. They don't do it now beside the dental caps. And if they want you to hold your warfarin prior to this procedure, then you probably need to discuss with your doctor for platinum medication or the anticoagulation or recommendation. If you have to hold your warfarin, follow your doctor or the anticoagulant instruction. If you have to hold your Eliquis, Gelato, or Badaxa, then may need one day, right? Needed. Again, you need to discuss for doctor any recommendation. Or if you have to hold your warfarin or Eliquis, Gelato, or Badaxa, you need to check dental, see when you platinum. If they don't have any instruction, idea when you need to, then you need to consult with your doctor, manage your platinum patient or your hypoid for the instruction. If you have no active bleed, they might let you resume the platinum medication same day after the right. So prior to a dental caps procedure, you don't have to hold for platinum medication unless otherwise it's instructed. Check your INR if needed. Critical INR recently or INR history not stable. You have active. You should let your dental or healthcare providers, surgeon know if you have any concern like active bleeding or any major bleeding that you have in that for platinum medication. Okay, if you have any further questions, concern, please let know in for the dental cleaning procedure. What you need to do prior to dental cleaning procedure if you are taking platinum medication like warfarin, Eliquis, Boto, Badaxa. So I would recommend that you should not hold a platinum medication for a routine dental cleaning. If your INR, if you're taking warfarin, you need to make sure you are stable with your INR level. You don't have critical INR before routine cleaning. If you have critical INR, probably you need to hold your warfarin for a few days in order to get your INR to the therapeutic level. So avoid your routine cleaning if you just have the critical INR, like over 5 or your INR over 6, or you have any active bleeding with warfarin or platinum medication. For the deep cleaning, if you have to have a deep cleaning in, on the platinum medication, consider to hold your warfarin. You need to check with your doctor who manage your platinum medication. They have to review your iron history, and then they will give you some recommendation based on your warfarin and your iron history. Generally, if you have a stable iron history, then and then your current iron is therapeutic, and they might recommend that you hold for 1 day prior to the procedure. If your iron, if your iron is not stable and has a history of elevated iron, then they may recommend that you should hold for 3 days prior to the procedure. But they need to test your iron prior to the procedure, usually within 24 hours of the procedure. And then if you are taking the Eliquis, Geralto, but that's and then you don't have any kind of bleeding or anything, any active bleeding, such as nose bleeding, stomach bleeding, or blood in your urine, and then you might need to hold for 1 day prior to deep cleaning. And again, if your dentist, they are not concerned about your bleeding, and then they don't recommend you have to hold your platinum medication, then you should not hold your platinum medication. You don't have any concern about bleeding. If you are stable with your warfarin doses, and then you have a good history of your iron therapeutic time, then you should follow your dental recommendation. If you have concern, you should always ask your doctor who manage your warfarin. Make sure you are safe from any procedure. Okay? If you hold your warfarin or your Eliquis, you should resume your platinum medication as instructed by dental. If you have any question, you ask your doctor who manage your warfarin when you resume your platinum medication. Generally, if you don't have any kind of bleeding, or if you don't have any instruction from your dental when to resume your warfarin, then your doctor who manages warfarin might have you to resume your warfarin after the procedure. But you need to double check if you are safe. All right, so any further question or any concern prior to dental procedure, what you need to do when you are taking the platinum medication, please let me know the comment below.